How do you monitor your prostate cancer when you're on an active surveillance program? Men that are on active surveillance have a long-term commitment to monitor rather than treat. So what is the process? How do you track prostate cancer and make sure that it doesn't get out of control? Historically, this has been done with regular prostate biopsies. Johns Hopkins, one of the leading centers, does a prostate biopsy every year. And I've talked at other times about the potential dangers of biopsies, and everyone realizes they're uncomfortable having needles poked in you. So now that new imaging studies are showing accuracy that is as good or possibly better than biopsy, many are asking, why can't we do imaging studies instead of biopsies? And the answer, it seems to me, is mostly, well, we just haven't done it that way. We've always done it the other way, and that's what we're comfortable with, doing it the way we've always done it. And that's the doctor speaking, of course. And about 1 million men are getting biopsied every year. So there's an existing business plan that men get regular biopsies as a part of monitoring. However, I don't ascribe to that anymore. If you think about it, men that have these low-grade cancers have an innocuous condition. They already had one biopsy to look for high-grade prostate cancer, and it wasn't found. Why are we punishing these individuals with repeated biopsies? The biopsy would be better served being administered to men that we don't know or haven't had a biopsy before. But instead, it's being given to these men on active surveillance as a, quote, method for being safe. It probably made sense before imaging started to show the accuracy we're seeing now. But at this point, I believe regular biopsies for men on active surveillance is an antiquated approach, and it is potentially dangerous. So imaging, of course, there's always a caveat that imaging needs to be done at a quality center because some people don't know how to do it right, and they don't even know they don't know how to do it right. So the public has to be aware of the fact that this technology is new, and there's spotty quality at different centers.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.